Welcome back to Health Bulletin. So, hear what's happening right now in global health. From unexpected heart risks in kids post-COVID infection to a virus that can travel through a wall. Let's break down the top 5 health headlines you really should know. Okay, this first one's kind of a wake-up call for parents. A major study from the University of Pennsylvania just dropped, and it shows that kids and teens who've had COVID-19 might be at triple the risk for heart problems. Researchers found a significant increased risks of hypertension, myocarditis, arrhythmias, and heart failure. The data, collected between March 2020 to September 2023, which included approx 3 lakh children and adolescents who had contracted COVID-19. All participants were monitored for at least 6 months. The findings revealed a statistically significant increase in the risk of several cardiovascular outcomes among those previously infected with the SARS-CoV-2 virus. What more shocking? These risks were present in children both with and without congenital heart defects. The study urges early detection and monitoring to prevent long-term cardiovascular complications in young patients. It means symptoms like chest pain, fainting, or fatigue shouldn't be ignored. Even if your child had a mild infection months ago, it's important to have regular follow-up with your doctor. The good news? Catching it early can make a huge difference. Researchers urged healthcare providers to monitor children and adolescents post-COVID infection closely, even if initial symptoms seem mild. Now we all know a dangerous measles outbreak is sweeping across parts of the United States, and as measles is back, and it's spreading fast. Over 700 cases across 6 states, and amongst all, Texas is getting hit the hardest. Sadly, there have been already lost 3 lives, including 2 kids, CDC and even U.S. Health Secretary Robert F. Kennedy, despite his past skepticism of vaccines, is now urging Americans to get vaccinated against measles. He said, "This is not the time to question the science. The evidence is clear. The measles vaccine saves lives." Now CDC are urging booster shots for travelers because measles spreads like wildfire if you're not vaccinated. One sneeze, and 90% of nearby unvaccinated people could get infected. So if you're planning summer travel, double-check your records. Now let's talk about something even sneakier, something many haven't heard about but is already killing millions. This one hit hard. More than 3 million children died in 2022 from drug-resistant infections, that's right. We are talking about antimicrobial resistance, known as AMR. Antibiotics are losing their power, especially in Southeast Asia and Africa, and we're seeing a scary rise in superbugs that just don't respond to treatment. If you're wondering, why is this happening? According to a WHO report, because of overuse of antibiotics in people, in farming, even in animals, and now kids are paying the price. Experts in World Health Organization is asking for global action. Countries are spending hundreds of millions in research trying to bring extinct animals back to life, while on the other side, we're losing kids to infections we used to beat. AMR has been identified as one of the biggest public health threats facing the world's population. This new study highlights a more than 10-fold increase in AMR-related infections in children in just 3 years, and the number could have been made worse by the impact of the COVID pandemic. These findings should serve as a wake-up call for global health leaders. Without any decisive action, AMR could undermine decades of progress in child health, particularly in the world's most vulnerable regions. Let's take a look at this next study that is bound to surprise you. It might seem like something from science fiction. Back in 1959, researchers in Pretoria, South Africa, built a facility to study how tuberculosis spreads through the air. And fast forward to now, scientists used the same setup, but this time with COVID-19. And what they found is actually quite wild. Researchers, led by Chad Roy from Tulane University, have used the South African Airborne Infections Research Facility to illustrate human-to-animal transmission of SARS-CoV-2. and the study was just published in the last week of April this year in Open Forum Infectious Diseases. They had human patients with COVID in one room and hamsters in a separate room connected only by a ventilation system. After a few days, more than half the hamsters had developed antibodies. That means the virus traveled through the building's air and still managed to trigger an immune response. The study was conducted with 7 COVID-positive patients and 216 hamsters. They spent a cumulative 409.5 hours in the AIR facility in the last 2 weeks of November 2022. The bottom line is that this confirms just how persistent SARS-CoV-2 is and how important clean air and ventilation still are, even years after the peak. And lastly, another under-the-radar virus with a surprisingly deadly twist. RSV usually makes headlines for babies, but a new study from Denmark found adults with RSV are 2.7 times more likely to die within a year of infection. Yeah, you heard that right. It's not just a cold for everyone. The study followed thousands of patients and showed that even after they recovered, many ended up with worsened asthma, chronic lung problems, and increased hospital visits. Especially if they already had conditions like COPD. So if you're over 50 or have underlying issues, RSV isn't something to ignore anymore. Talk to your doctor about whether the new RSV vaccines could help. So that's all for now from COVID's lingering risks for kids to and the silent threat of RSV in adults. If you found any of this helpful, share it with others and subscribe Health Bulletin for latest update on health and science.